In 2015, I was fired from a major US hospital, and I wasn't the only employee under discrimination pressure. I saw what happens throughout a major US hospital when one employee is in need of access to her employment rights. I spoke with the nurse manager who wanted to help but confessed that her hands are tied. I worked under a nurse manager who withheld key transplant training information, risking patient outcomes to burden me, and who told me it's business decisions. You understand. I met with the disability managers who fostered a close working relationship with EEOC mediators. I witnessed his ability to influence workers' compensation adjusters and doctors. I experienced the quick denial of gainful employment through nurse recruitment, and I experienced it all as an employee whose health, career, livelihood, and soul was on the line. That experience changed the way I see my role as a professional registered nurse, whose responsibility is the protection of life and the prevention of injury and death. Like I said many years ago, I'm just doing my job. These are the six whys major US hospitals need workforce care. We're protecting people, performance, and profit. Today is July 28th. And this is why number one, because the system is the system. Your staff must learn how to navigate it. I asked the nurse manager for help. She wanted to help me, but told me something profound. I can't help. My hands are tied. Your staff wants to do the right thing. Your administrative nurses also want to do the right thing. But sometimes when they take that thing to upper management, denied. I won't get into all of the whys from insurance consideration to stakeholder interest or even what that feels like on the ground at the line between the nurses and the nurse managers. But there is still a shared responsibility. Employees have employment rights. Their need to access those rights does not depend on you. It does not end because management said no. That employee still has a right. And it has nothing to do with employment rights like the right to employment or at will employment. What you're doing when you deny somebody their employment rights is a discriminatory and it is illegal business practices. It's harmful and it participates in causes America's public health crises of death, disease, and poverty, as well as chronic stress related diseases, preventable diseases. It keeps you in business, but the people need to understand what it is that they are experiencing and how they can protect their own interest and their own future and their own health and break generational curses that happens within the workplace and causes poverty, mental illnesses, high blood pressure. I was told by the disability manager at the major US hospital, you have the right to sue. And they're right. Suing is an employment right. But litigation can also be difficult. It can take a toll on health, contribute to mental health disparities and illnesses, and affect future employability. Employees also have the right to know, the right to information, and the right to be informed and consented before they enter into the system and be supported with what it is that they experience when they get into the system. Because many of them don't make it through. Many of them faint for disbelief. Many of them are overwhelmed. Many of them are disillusioned. And cognitive dissonance is a huge thing, also. People need support in those areas. Your employees, as professional registered nurses, your healthcare consumers who come to major U.S. hospital, community outpatient clinics for job related stress issues also should be given information and offered the least invasive treatment option. And this is why another wellness benefit will not solve this unique, huge problem. Major U.S. hospitals have already invested in employee resources, benefits, policies, and systems. The problem is not always that another resource needs to be added. Your employees need the education to understand and apply benefits, rights, and resources that are already state and federally mandated, paid for, and required as conditions of doing business. These same protections and conditions of business, workforce care should be a condition of employment for your employees. Let them have the opportunity to opt out of safe navigation through the system. Now, let's consider the right to know. What if new hires learned during their onboarding and employees were reminded throughout newsletters and annual anti bias, anti harassment, anti discrimination, and what is it, evade the violence subscriptions that they have to do for onboarding and for yearly education? Why don't they learn why faith adherence to employment law matters in the protection of their own health, career, and lives? What if we removed the expectation that the institution alone is responsible and replaced it with a shared responsibility? Teach employees the different purposes of human resources, occupational health, disability management, FMLA, ADA accommodations, workers' compensation, mental health services, and organizational complaint processes. Those are all your allies. They need to understand what the definitions are. Not two institutions or entities have the same definition of a disability. A lot of employees are always in the mindset of I'll sue, but then they don't even have the correct documentation. This is shared responsibility. Your employees are hired for a business decision. Employees and employment is a business activity, and they should have the information that they need so that when things go left for them, it don't have to be that they're just thrown out as corporate waste and that they're exhausted and spent and merchandised throughout the system. They should have the information that they need to build up good faith, morals, standards, and endurance to pursue instead of being exhausted, stressed out from chronic stress without any information and have nothing left in them to make one decision that is going to save their future because of job stress. I think that if we teach them what questions to ask, where to go, what documentation may matter, and what responsibility remains theirs, that would free up your image. That would free up your money. That would free up wasted resources that you are already paying into. This is not, to say that every system works perfectly, but I think that when individuals, I know what I needed when I went into psychiatry behind workplace discrimination, systemic employment discrimination. I know what I needed. And what I needed was not 45 minutes of weekly therapy so that I can learn to be mindful with the assault that was taking place against me. I didn't need an antidepressant so that I can ignore my body's stimulus to respond in a fight or flight manner so that I can overcome the stressor that was before me. And I certainly didn't need electroconvulsive therapy to shock my brain happy because within 6 weeks of seeing a psychiatrist, I should not still be upset about my employer making business decisions. I am very upset about employees like US major hospitals making business decisions that impact health, that causes health disparities, that causes poverty, that causes mental illness, that causes and contributes to suicide and domestic violences. I'm very upset about that. This is why your staff, educated as they are, as talented as they are, must learn how to navigate it. This is why, number one, US major hospitals need workforce care. Employees who are experiencing workplace distress need a system level approach. They need to understand their rights, their responsibilities, their resources, and their options while they still have the capacity to make um, informed decisions. Let's help good employees stay upstream before workplace problems unnecessarily become a medical problem, a psychiatric diagnosis, or a medication pathway. Educate them before they need it and provide support for them while they're in the